everyone, it's Heidi, and welcome to our Mom Hall, which is entitled today, Everything You Always Wanted to Know About Pregnancy and Postpartum Sex, but Were Afraid to Ask. And this is my favorite topic, and I think I can say the same for my co-host today, Dr. Sherry Ross, also known as Dr. Sherry. And she's an OBGYN, author, co-host of Lady Parts, you definitely had me at Lady Parts, and a passionate advocate for women's health. Ditto. Hi, Dr. Sherry. Thank you so much for joining us today.
Hi, Heidi. Thank you. It's such an honor to be talking to you today. I'm a big fan. You've done so much for women's health.
Well, ditto. And today, mamas and dads who are watching, we are going to answer questions sent in from the community. And from those watching, you can add your questions live into the chat. And as long as I can read them, because I put my contacts in funny, so hopefully I can, then we'll answer those as well as we get closer to the end. But we already have tons and tons of questions. And Dr. Sherry, I am going to start with the most obvious question of all, which is it safe to have sex during pregnancy?
Yeah, well, this is such a common question, and the answer is enthusiastically yes. You can't have sex. Everyone's a little, skittish about it, including the partner, but you can, and it really sort of depends on what trimester we're talking about as it relates to comfort.
So let's start at the beginning, first trimester. Are there any reasons why you wouldn't be able to have sex in the first trimester? And I say, this is like exercise. You have to go ask your OB or your midwife before you lace up your sneakers, and the same thing with sex. In theory, you should ask your provider first before you get busy. So in the first trimester, for most women, safe?
Yeah, I mean, it's safe. I think the first trimester, we're often not feeling as good, low energy, feeling nauseous, our breasts are tender. It's not high on our list. Because also there's an association, and it's a wrong association, between having sex and having a miscarriage, which is not true. But it is safe. It's definitely safe to have sex during the first trimester if you're interested.
And that's the thing. Libidos are all over the place normally and naturally at any time, but especially during pregnancy. And that goes for both partners. And I would say for me, I had two settings, hot and hotter, right? Because all those hormones felt super good down there. There was a lot of blood circulation, and I always was in the mood. My husband, Eric, would run screaming when he saw me, because that's how much I wanted, give it to me 24/7. That's not a universal experience. And with a lot of women, they're too busy puking, right, to even think about getting busy. And so, but in the second trimester, I would say, what would you say about the second trimester?
Yeah, that's the second trimester. You're feeling sort of back to yourself. All the good hormones are raging, and all the nausea is behind you, the fatigue's behind you, and you just feel good. That second trimester is the time to just get your checklist done. And sex is usually up there because you don't feel so tired. And you're confident now, the pregnancy is on its way. You've seen many heartbeats, you feel the heartbeat. So emotionally, you just feel good. And you're not too big where, finding the right position, getting comfortable, it isn't as challenging as the third trimester, which we can talk about. So now you're feeling good, you have good energy. And when you have good energy, usually you're feeling more sexual, and it's good for the libido. So the confidence of having a healthy pregnancy is behind you, and it's really a good time to be sexually active.
Good times. I
mean, it's all about comfort.
Yeah, and it's all about, I would say, good communication with your partner, because intimacy, sexual intimacy is just one part of your relationship, but it's an important part, especially if you're not talking about it. And I would go back to the first trimester or the third trimester, when maybe you might not be in the mood, or maybe he's not in the mood, and talking about it rather than, giving the impression that I don't love you anymore, or I don't find you sexy, those kinds of things. But there are a lot of challenges to getting your sexy on when you're pregnant. For some women, that's normal. Normal is what's normal for you. And the third trimester, as you said, it's like, climbing the peaks of Mount Everest. Like, it's really the gymnastics involved with sex are challenging, right?
Yeah. And, we're not so versed with Cirque du Soleil positions, especially in our third trimester, because, and you're right. I mean, by that third trimester and, you've gained the weight, your nipples, you're, putting out the colostrum, and you are not feeling sexy. Lights may be dimmer. Well, it depends. It depends.
Exactly.
And this is where, to your point, Heidi, I mean, communication is so important, because, everyone's feeling needy. Pregnant woman is feeling needy because she's maybe, at the, sort of that 0.3 of the marathon, it's underway. The partner may not be feeling is given as much attention. They're already feeling that challenge. So I think it's communicating how you're feeling, and just knowing this is normal. I mean, it's so normal, and you just have to sort of own it and discuss it, and include your partner for sure. But getting comfortable is the key, because at this point, I always talk about the 3 C's with my patients. The communication, comfort, and cuddling. Because a lot of women, they like to cuddle, and so anything intimacy related, spooning, side by side, intercourse is usually preferred, and even on being on top, you can sort of control sort of penetration in a better way. A lot of women don't like positions of deeper penetration, so from behind or doggy style. It's not always their preference for sure. And certainly the male partner, if you have a male partner, deeper penetration, they're always, worrying about hurting the baby too. So again,
you're going to get to that.
We'll get to know that more, but it's really communication, and comfort.
And a sense of humor, I would add. So what about painful sex? If you are experiencing pain during pregnancy sex, first of all, why might that occur? Especially if you didn't have pain previously. Is it a matter of mind over matter? Is it, perhaps that you're nervous and you tighten up? What do you think?
Yeah, I mean, pain, again, it really does depend on, what trimester you're in. You shouldn't have pain. I mean, that, pain at any trimester is not something that, we should consider to be normal. Right. So positioning, we've talked a lot about positioning, and I think that's, first where you need to start. And the other thing is being well lubricated. I mean, you have to be well lubricated to enjoy, anything going on. I mean, we're talking about penetration sex, in this conversation, but I think, being comfortable, being in the right position, and being well lubricated, because, right, where does our libido get started, right? It's above our biggest sex organs, above our shoulders, right? So if you're comfortable and relaxed, you're going to get lubricated, but it's all goes hand in hand. So, getting comfortable is really important in having good lubrication.
And sometimes it's a matter of too much of a good thing for women, and for their partners. If, you produce more secretions when you're pregnant. And so it can be like what are they called? Slip and slides. You could do so much lubrication that it's hard, either for him to keep an erection or for you to feel the pleasure. And that's, again, very individual. Your results may vary. So, use the lubrication if you're dry, and if you're not dry, then you don't need it. But I think setting the mood is important. As you mentioned, you've got to be setting the mood and feeling good about yourself
Yeah. I mean, that's for us women, you know, that's really where it starts. Or certainly vagina owners and, you know, the
Yes,
clitoris is where all the magic really happens.
yes,
And it's the same in pregnancy. If you're not getting stimulated, you know, with the, you know, sort of with pressure or oral sex, which you still, you know, of course is safe in pregnancy.
yes. I was going
Um,
to ask you that.
yeah, I mean, 'cause you know, you've heard, I mean, I just remember even when I was pregnant, like if I was given oral sex, I might have like an air embolism going into my
Right, right, right.
vagina, which is a myth,
Yes,
misinformation, just wanted, yeah. So, you know, but again, our pleasure, pregnant or not, it centers around the clitoris. And
yes.
so in pregnancy, and because there's so much more blood flow, you know, as the pregnancy gets going, you know, you feel really heavy down there. There's just so much blood flow. I mean, that can be great. You can have the best orgasms of your life during
Or
pregnancy.
orgasms for the first time. I mean, that happens too when you're pregnant. Not universally. Again, if you're not in the mood, if you're puking, you feel sick all the time, you hurt all over, then not necessarily your sexiest moment. But if you feel it, then definitely go for it. And you touched on oral, and I would say anything goes except just keep in mind when you're giving your male partner oral, that your gag reflex is extra sensitive and that might spoil the moment. So, but otherwise completely safe as long as nobody has an sexually transmitted infection. So that's good. Now, what about self-pleasure?
Oh,
Using
yeah.
a vibrator or
Vibrator.
just fingers or any kind of sex toy.
Well, 100% yes. In fact, a
Mhm.
lot of women love to use vibrators during pregnancy, and it's completely safe and lowers pregnancies. So, you know, history, you know, preterm labor, your placenta is in a normal position. It's not low by the cervix, and there's no previa or no, you know, sometimes twin pregnancies we also might caution, but sex toys, vibrators are wonderful. And it's, you know, it's such a nice moment to have with yourself, to have a, you know, vibrating moment of or not, to have an orgasm, because orgasms are very, right, they're very therapeutic. They're very,
Yes.
you know, to have an orgasm, it's sort of a stress reliever, it's a calming
Yes.
feeling, and it just kind of feels good. I mean, always taking matters into your own hands.
Yeah.
I'm all for that. I just think it's so important, and it's a really good mood stabilizer too. So I'm all for it. And I like to tell my patients too to, you know, have a moment to yourself and just enjoy yourself. And it's you know, the best Prozac you can have.
Exactly. And it releases all those feel good hormones. Some moms worry because they get a little crampy after having an
Yes.
orgasm, and just reassure us that that is not an issue.
Yeah, and that's such a good question because, you know, when you're not pregnant, I mean, what's happening to your body and all this blood flow as you're stimulating yourself and bringing, you know, a lot of tension to the pelvis. Once you do get over that edge and you have an orgasm, the uterus normally contracts.
Mhm.
And it tightens. And a lot of women, you know, it can be very intense and it can be scary. Well, when you're pregnant and you have this big, you know, watermelon sitting on, you know, in your belly and it starts to cramp and tighten, it can be alarming. But when it's with an orgasm and sort of the natural, you know, process, it will go away. So if you're having, you know, a few rhythmic contractions over the course of a couple minutes, that's normal. If it then continues over the next couple hours and gets more intense or even painful, you know, that would not be normal. And that would be a time that you'd contact your healthcare provider.
But you should not worry that unless you've been told otherwise by your provider, you've received caveats about what is safe and what is not safe. You should not worry that those contractions are a sign that that you're having preterm labor, unless, of course, as you said, it continues and continues and continues. So, you know, I get this question a lot, believe it or not, but about anal sex. And
Yes.
for those who are fans, and I feel like it's very much a love it or hate it kind of thing, but for those who are fans or open to it, should we proceed to the back door with caution when we are pregnant?
Yeah. And this, listen, I think this is a great question. And, for somewhere around the 40% that really enjoy anal intercourse, I think in pregnancy, because you're worrying about anything touching the cervix, anal intercourse sometimes is preferred. But again, you want to just think about the same strategies communicating for comfort. Position is really important, deeper penetration, maybe uncomfortable. If you're carrying this baby, and making sure you're well lubricated. Kind of the same rules. The same rules will apply. The same if you're low risk, go for it, have a good time. And again, cleanliness is important, not introducing. You never want to go from anal to vaginal with, issues related to bacteria, E. coli, of course, and that can lead to bladder infections. So same rules apply. And just use common sense. But yeah, no problem.
And same, oh, definitely. And cleanliness also applies when you're talking about your vibrators or dildos or anything else you're inserting into any of your lady parts, right?
Exactly.
And what about those who are told they have to be on pelvic rests? So some may say yay when they hear that their vajay gets a vacay, and some may say not so much. So what does pelvic rest really mean? And why is it important to get those details from your provider if they prescribe it?
Yeah. So pelvic rest, basically means nothing can go inside your pelvis, inside your vagina or anus, right? But nothing inside the vagina. So that traditionally means no vaginal penetration, whether it's a penis or a dildo or fingers, pelvic rest, and no douching. Nothing in there. Nothing goes inside the vagina. So that's what it means, and it's usually given. Those instructions are given to patients who are having any issues, whether it's preterm labor. Sometimes if you're having uterine irritability, you haven't quite crossed into the preterm labor category, but you're having contractions, no cervical change. If you're bleeding, that's another common reason that you would have a pelvic rest. And two, no exercise, even though it's nothing inside, the vagina itself, but that could also mean no exercise. So if there's any concerns, cervical shortening, if you are carrying twins, if you're at risk for, even, preeclampsia, we may say, nothing strenuous. So sometimes you have to ask your doctor, ask your healthcare provider, what does this mean? Questions, bringing up these questions, getting more details. You have to pull it out of the doctor. You have to pull it out of them. That they're on a time, limit.
Right.
And you have questions to follow up with. You're just not clear. You got to go for it. If we can't get it out of Heidi's books, which we often do, you have to. This is why you've hired your healthcare provider.
Exactly. Actually, on that topic, someone just did ask, how about sex after IVF? Does that require pelvic rests for some period of time? Are there certain restrictions after that?
Yeah, again, the answer is usually yes. IVF pregnancies, they're like our most special and guarded because it's taken them so long and it's often costs a lot of money to sort of get there. We work, in tandem with an infertility doctor. Often, they'll say, definitely not the first 12 weeks, nothing inside the vagina. But again, this is a perfect question you need to ask, your IVF doctor, when can something come back into my vagina? And, that's a good question because you don't really know the circumstances.
I'm getting some really great questions here from the community, as always. would you suggest it's okay to check your cervix with your fingers when you're pregnant? Mom on Instagram just messaged me about this.
Yeah.
Try this at home or leave it to the profession.
I would say why
Why
have
would
that urgent burden? Let us deal with that. I mean, if it's hard, and I applaud that woman that she even wants to, because I think it's you're really aware of what's happening, but really measuring cervical length is done best. Even it's hard to do on an exam. We do it on ultrasound, right? We're looking, sort of at that measurement of 3 to 4 inches, looking at a cervix. So I would not do it. I just wouldn't go there. I think I would leave that to the healthcare professional. And if you have any worry, I would just ask for an ultrasound to measure that cervical length.
I think she said, is it safe to stimulate the cervix? And I'm wondering if she means sexually stimulate or actually expedite the labor train.
Like maybe she wants to strip her own membranes, because I love that, really. But if you want to do that, I would certainly wait until 39 weeks.
Yeah, and clean fingers.
I've heard that question before, but it may, you have to have a long finger too. But maybe as it relates to the issue of intimacy and sex, because the cervix can be stimulated, and a lot of women do notice more discomfort when the cervix is sort of being pressed against from a penis or a dildo or fingers. So some people notice cramping. I don't know if you've all noticed, but when you get a cervical exam, right, by your when you get a cervical exam by your doctor, when you start at 38 weeks, you may feel cramping, and often I'll tell my patient, hey, I'm going to check you now, and when I put my finger in your cervix, you may notice cramping. So that's probably it's common.
And also, if you notice some light spotting, brown dried blood a couple of days after, a day after, often that's related to the cervix, which is so more vascular when you're pregnant, and so it's easy to bruise it, but not in a dangerous way. So if you notice just a drop here and there after having had sex or an exam, that's probably why, right?
Yeah, that's actually very correct and very common. And spotting, can happen. There is so much more blood flow to the vagina, to the cervix, and when it's and so it's just more what we call friable. So when anything touches it, it just bleeds a little more easily, and that's not unusual, but it should be spotting. It should not be bleeding like a period, and if it does, that you should bring up to the attention of your healthcare provider.
And one thing that I remember, you mentioned douching, and if you are on pelvic rest, but I just wanted to mention that douching should be off your pregnancy menu. Actually, you shouldn't really douche, period, but definitely not.
It should, douching just should never happen. Pregnant, postpartum, non-pregnant, it is just not good for the vagina. It just removes all those healthy, foot soldiers in the vagina, keeping it nice and clean. Same for pregnancy.
I love the foot soldiers. I'm trying to imagine foot soldiers in my vagina, but yes, you mean protection. Yes, protection. That's great.
Right.
This is a great question. Does sperm inside every time you have sex? Oh, does sperm have any negative impact on pregnancy? And I am wondering if this mom is referring to, the fact that sperm have prostaglandins in them, which is basically, an arguably more fun way to ripen your cervix, but only if conditions are indeed ripe and ready to go. So sperm, any risks to sperm, in your opinion?
Yeah, no, I mean, sperm should not have any negative effects as far as infection wise, which is good. So it's all okay.
Come on board. And the only reason you would need to wear a condom, of course, if there's a risk of a sexually transmitted infection or something like that. I love this one. how much sex is too much during pregnancy?
Oh, wow, right on to you.
Yeah.
There's really it can't be harmful unless you have any pelvic pain or again, low risk pregnancy, no risk factors, preterm labor, premature rupture of membranes, short cervix, twins. You might get restrictions, but there's really no too much. I mean, if you're enjoying it, you're having a good time, more power to you. Enjoy it. You must be a very calm person and very happy pregnant woman. That's what I would say.
Exactly. Now, a mom did also ask, how do I reassure my partner that it's safe, that he can't hurt me or the baby when we have sex? And this is something I get so many times. Oh, I can poke the baby in the eye with my penis, giving yourself way too much credit. Or baby's watching, can see me, they're just weirded out by the whole thing. What's your best advice for partners who are concerned about sex during pregnancy?
Yeah, I mean, this fear of hurting the baby with sexual intercourse is so common. And it's probably one of the biggest misconceptions, as you've said. And I mean, yeah, think about it. This baby is surrounded by 1 to 2 liters of fluid. I mean, it's just basting in this beautiful bath. And so with intercourse, yeah, I mean, there's probably motion going on, and it may be very soothing to the baby. It could be rocking the baby, which is nice. But you can't hurt the baby, again, as long as you're low risk. There's really no chance of a miscarriage or breaking the water, or some of the sort of the old wives' tales that we all have thought. Or even putting you into preterm labor, it just doesn't happen. So, reassuring is what I would do, and educating, right? It's a process for you and your partner to be educated along the way. And this is one that I think is really important to have early on.
And that's why I think it's important for your partner to go to your prenatal visits. And I'm a huge advocate, and I feel it's really important for providers to speak directly to the partner and say, what questions do you have? And encourage that interaction, because this is a team sport. Yeah, you're doing all the heavy lifting, but it is a team sport, and it takes a lot of communication and that group effort. And if he's got concerns, he should express them. I would say the dads often get so invested in their partner's safety that it can almost be like, I know I have a lot of moms say, my husband wakes me up in the middle of the night and says, get off your back. And, you can't control how you're sleeping. Yes, it's ideal to be on your side, but they become really, really nervous about their partner's safety. That's natural. That's normal. But he should get answers to his questions. So I think that's really important. And speaking of lubricants, mom did ask, are any lubricants completely off limits?
Not really. I mean, water-based, oil-based, silicone-based. I mean, they're all safe to be using during pregnancy. And it's really a matter of preference too, which one you like, as long as you're sort of, getting brands that are well vetted and, never hurts to I'd be really careful getting them. I don't know, online. I would just make sure you're getting what is safe and approved. So no,
Right. And should you reach into your refrigerator or your spice cabinet? What are oils from your kitchen or from your bathroom?
I'm a big fan of coconut oil. I really am. I'd be careful if it has, a shelf life and you take it off your, using olive oil or, a coconut oil that you also use for cooking. I would probably not, just for more, sanitary purposes.
Yeah.
But you can use natural, lubricant just as you normally would if you weren't pregnant. But again, you don't want to introduce any bacteria that shouldn't be there. So sometimes, be a little more mindful of using things that, they're just not as well preserved with some of the preservatives that keep shelf products, free from bacteria.
And I think probably that question is partially inspired by the fact that when you're trying to get pregnant, if you're TTC, you're told to avoid certain lubricants, and including saliva, a sperm killer. Who knew?
Yeah,
Um,
sperm
so
killer.
yeah,
Yeah.
we don't want to be the spit girl in that case. But yeah, I think that's probably where that came from. Now, is it normal to be, this is a really great question, extra smelly down there? She's 7 months pregnant. And so, you know, you're making a lot more secretions. They definitely smell different, but how different should they smell? And when is it a sign of an infection or something you need to get medical advice about?
Yeah. Well, you're definitely more sweaty. Let's just say by 7 months, to your point, the progesterone is in full stride here, and that makes us warm, and you're carrying more weight. And all these things do create more sweat. You're still following the rules. You are what you eat in a lot of ways. The foods that you're ingesting, the vitamins you're taking, they all get into your fluids, and it's no different. And there's more secretions, right? More blood flow, more secretions coming out of the vagina, more watery, but everyone's a little bit different what they're smelling, and I'm sure some of the hormonal changes might affect the odor that's being produced. So that's probably not anything to worry about. When it would be a concern, same things if you're getting any itching or excessive curd-like discharge, or the discharge has a different color, yellow, green, gray would not be normal. Milky is normal. And itching, those are kind of classic. It could be yeast or bacteria. Very, very common. Sort of the microbiome, I like to call them foot soldiers of the vagina. They want to keep everything in order. Yeast is very common, and you may not even know you have it because you're so swollen, you're just not sure. But it's very common. You should just go get a culture from your healthcare provider, and that way you'll know if it's abnormal.
And I would say, and I imagine you agree, don't self-diagnose, self-treat infections when you're pregnant. You may be used to reaching, for the drugstore shelves if you get yeast infections often. What are your thoughts on probiotics? Because I'm a fan.
Yeah.
And, just being more careful about your sugar intake when you're pregnant, even though that might be all you want to eat. But does that give the yeast something to feast on?
I'm a big fan of probiotics too. Huge fan. And I would say, and there are some really great ones that we do use in pregnancy, and they're safe. It's sort of lactobacillus is the king or queen, let's say in this case, in the gut and in the vagina. And we're more prone, to infections, and not just yeast. We all think itching, discharge, yeast, and often we're wrong. So I would encourage everyone not to just go to CVS, get the monostat, because if it's not yeast, it's going to cause burning. And you definitely want to insert anything that you don't need, because that will worsen symptoms. But share this with your healthcare provider and talk it through, because probiotics are a little controversial, and a lot of healthcare providers aren't that progressive, and they may say no. But I think really there's some brands out there that are great and helpful.
And you can always have some Greek yogurt and get a lot of protein in the bargain. This mom said, I'm high risk due to cervical cerclage. Is it safe to have sex before? Oh, she has, not due to it. She has to have a cervical cerclage. Is it safe to have sex prior to the surgery, the procedure?
Yeah, I mean, again, not knowing the circumstances and the why, I would run that by your healthcare provider, because again, the prostaglandins that are secreted within having a male orgasm could affect that, and I would be very careful, and I would ask your healthcare provider on that one.
That's always my go-to, even if I'm giving advice, ask your healthcare provider because your situation is unique, your body is unique. And so always ask your provider who knows more about that, those conditions. We have so many questions. Oh, coning. So this mom, after sex, her uterus goes into coning mode, which I've always associated during my pregnancies with having Braxton Hicks. You know, your
Okay.
belly goes into this weird cone shape. So is that
Yeah.
is that
Yeah,
any?
yeah, I've not heard that word coning, but that's right. You know, Braxton Hicks are painless contractions that they really start in the first trimester. I mean, we notice them if you have a full bladder, if you're exercising, you know, if you're having sex, the uterus tightens up like a hard ball, and you
Yeah.
really notice, you know,
Okay.
that third trimester. But again, as long as they're painless, there's no association of pain. I mean, and sometimes, I mean, if you're noticing them more frequently, like 10 in an hour, and that they're persistent for 2 hours. I mean, I even have my patients, you know, notify me if they're having painless contractions that are frequent. Is this the buildup to preterm labor? You just don't know, but usually not. Usually not. And that contraction or coning is normal.
Excellent. Can sex be too vigorous or rough during pregnancy? And I would say a lot of that, and I would love your take on this, would be your comfort level, what hurts, what doesn't. That's where communication, I think, is so important, because, you know, it's, you know, men often don't stop to ask for directions, and your GPS is different when you're pregnant. Postpartum, it's also very, very different, and you need to know what feels good, what doesn't feel good, and speak up, and you be the one in charge of sex. I would say also that, you know, people worry about jogging during pregnancy, and would be the same kind of thing, you know, a lot of bouncing up and down. So what are your thoughts on this?
Yeah, I mean, again, and I think your point is well taken. Aggressive sex can be fine, and as long as you're comfortable and you're not having any pain, right? And speaking up is really important. But if it's aggressive sex and you're noticing, you know, pain or discomfort or that ow, I mean, you don't want to just give your partner whatever they want just because
Right.
you feel badly, which happens a lot. A lot of times you're like, just going to do it. I'm just going to do it and get it over with. But nothing should feel painful, because, you know, that's not a good thing. You know, your pelvic organs, right? Your pelvis is changing from all the hormonal changes in the preparation of having a you know, vaginal birth, at least from the hormones. So there's loosening of ligaments, and it can feel sore, right? That feeling like you just got off a horse is no joke, because it's real as your pelvis is in preparation. So you might even be more sensitive to certain positions and deeper penetration. So, you know, use your words. Don't be afraid to speak up. I think that's really important.
And of course, no woman should ever have sex if she doesn't want to, be coerced to have sex, because your body, your business. Pregnancy and sex are both team sports, but both participants have to be okay with it. And you should always speak up if your partner is forcing you into something that you don't want to do, or worse, of course, hurting you. You should never, ever, ever allow anyone to hurt you when you're pregnant or otherwise. So that's important thought. What about pelvic floor therapy? And I am a huge fan, because I've never heard anything but glowing reports from moms who seek help from an experienced certified pelvic floor therapist who knows what they're doing, specializes in pregnancy and postpartum, in terms of aches and pains during pregnancy. but also easing your mind about things like sex during pregnancy. For some women, I always said, do your Kegels. And I was reminded that some women actually shouldn't do their Kegels because they're too tight to begin with. And all that pelvic floor exercise isn't so great if your pelvic floor muscles are actually super tight. So for going to a pelvic floor therapist preemptively, even if you're not having problems, especially if you are having problems or you anticipate problems or you've had problems in the past, what is your take on pelvic floor therapy?
Yeah. Well, I'm also a huge fan of pelvic floor specialists, and we're seeing a real surge of them, and often women are finding them without their healthcare provider, but usually we see it a little more postpartum, when there's a lot of damage being done to the pelvic floor with childbirth, especially vaginally, but pregnancy alone causes a lot of stretching in the pelvic floor, and that supports your bladder, your bowels, and the whole vaginal area. So you start to feel that happening in pregnancy. You still feel the pressure, you have loss of urine, you jump out on trampoline, laughing, you're, having that little pee come out normal. And some people also have rectal incontinence. That's not unusual. But postpartum is a really good time to mention it to your healthcare provider. It's covered by insurance, when you're having these symptoms. I mean, as you mentioned, Heidi, Kegel exercises, we should be doing them, pregnant or not, very important.
I'm doing them right now.
I just did 5 myself. Every time I hear the word Kegel, I do 5. But I think it's important because our pelvic floor over time, gets looser. And if you're not using those muscles, right, any muscle you use, you need to exercise it, including the ones you can't see. So pelvic floor therapy, postpartum, when you're having a lot of issues with loss of urine, you're not able to hold your stool as well. All these symptoms start to happen, and intercourse can be affected, or any pelvic enjoyment. Partnering with a pelvic floor therapist is really important and highly recommended.
Yeah, I feel like at least starting late in pregnancy, and especially if you're having things like hip pain, back pain, those kinds of things, you can get some relief in the meantime. And also, if you're a first-time mom, and I don't know your opinion on this, but perineal massage to prime your perineum for delivery is something that a pelvic floor therapist can show you the ropes and explain how it can help, especially if you have never pushed a baby out before. Thoughts?
Yeah, well, pelvic floor or perineal massage is a little controversial. Look, a cantaloupe, if you're having a vaginal delivery, a cantaloupe is coming out of your vagina, and the muscles. The vagina is like a superhero organ when you think about it, and the stretching that goes on is pretty phenomenal. And you don't really know the shape of the head, or you're pushing control, so it's never harmful to do perineal massage. Plus, it's kind of nice for you and your partner to do this teamwork activity. But again, there's a lot of stretching that's going on. The head is coming if it's vaginal, and it can be, quite traumatic. But I think it just makes you more vagina friendly, get your partner involved in touching you. And to me, those are all good things to do.
And I think another reason why pelvic floor therapists, as you said, postpartum can be so helpful, and even if you have a C-section, because they can help you with your scar, they can do all kinds of therapies that can help as well. But the main thing is, if you are worried about, as you said, leaking, or you assume that comes with the territory and there's nothing you can do about it, there is. And that would include pelvic floor therapy. If you think that your vagina everything will never be the same, and it will be different, it will change, but it's not necessary to have pain after delivery. You shouldn't be having continued pain. Sometimes there's some scar tissue. There are lots of things that a pelvic floor therapist might notice.
Yeah. I mean, painful intercourse postpartum is so common. I mean, it is, again, the fourth trimester, the least trimester we talk about, and usually rushing into having pelvic activity, or touching of any sort, anything going inside the vagina is hard. I mean, your vagina, if you've had a vaginal birth, is traumatized for most, especially first-time moms. The damage of the pelvic floor, whatever tearing. I mean, it's quite traumatic. And then, of course, if you're breastfeeding and you have no estrogen on board, this is your introduction to menopause, because you are now, you're getting the hot flashes, night sweats, you're moody, you're crying. I mean, it's a hormonal chaos. As you're transitioning, and the vagina gets very dry, red, burning, irritation. So it's really makes it challenging, to want to have anything going back into the vagina. And mainly this is for first-time moms. We see it more. And again, nothing's probably been in there for at least 6 weeks. So the opening, not only, it shrinks, but you have dryness inside, and there's no, natural lubricant. So all these things are happening simultaneously. And that's, real setup for, having painful intercourse when you first are given the green light at that 6-week visit, go time.
And that's the green light that we all wonder about, because there's always a question, very, very common question. Is the 6-week rule like the 10-second rule when you drop something on the floor and the baby eats it? Is it for real? Is it a one size fits all recommendation, or does it vary depending on what kind of birth you've had, whether you have stitches, whether you have, so if you had a C-section, all those different variables.
Totally. I mean, and then I think you just have to look at your own situation, because if you have to hear from your girlfriend that she's having sex at 4 weeks and you're not, it's another reason to feel badly about yourself, because you already are struggling with postpartum issues. And, it's hard. I mean, the first 6, I hate even to say 6 weeks, because it's really, I always tell my patients, it took you 9 months to get here. It's going to take you 9 months to heal on the back end. And I think it's for all things that are happening, but especially related to intimacy. You have to just look at your own situation and what feels right for you and what you're comfortable doing. And, did you have that traumatic vaginal delivery, and, you still healing? Because it does take 4 weeks for your sutures to heal, whether you had a C-section or you had a vaginal birth. And again, depending on, sort of the trauma that went along with it, because, we all sort of have a little PTSD when we think about anything going now in the vagina when something so large came out. So, communication with your partner and patients, and just talking it through. And if you need approval by your healthcare provider to feel good, and emotionally, how women are emotional when it comes to getting back into intimacy, I think it's really important, because it's hard enough. And I think we shouldn't put any additional pressure on ourselves.
Oh, goodness, no. If you're in the mood, though, that's a whole different story. If you want to have sex prior to the 6-week mark and your provider says, go for it. But if you're not in the mood, and that's more likely to be the case, our research team at What to Expect actually looked into the numbers, and they recently surveyed moms about sex postpartum, found that almost 25% of moms have sex before the 6-week mark. And they also found that nearly half of moms waited more than 7 weeks. Some moms waited 6 months to a year or longer. And another case of what's normal for you is what's normal, and no pressure. Sometimes it's a matter of you just are not in the mood because you smell I call it ode to spit up, like that's your fragrance that you're wearing, and maybe you haven't showered in a couple of days, maybe the baby's about to start crying, and so you're super nervous about getting busy. And the same goes for him, by the way. He may be worried about hurting you. That's where the communication comes in one more time, because you don't want to make assumptions about why he's not in the mood. Don't make those assumptions. Don't make assumptions of why she's not in the mood. Talk about it. That's the most important type of intercourse, is talking. And also going slow, letting him know if you're in the mood, not in the mood, if, what might get you in the mood, more help around the house, a chance to have a shower, those kinds of things. So talk about it and do what you feel is right for you. But if your holdup is pain, go see a pelvic floor therapist, because if you're having pain, after a few months still, the first time is different. The first time you have sex always is going to hurt somewhat. First time you poop, ouch, that hurts too. But you got to recognize the difference between normal, comes with the territory pain, and something less normal.
Yeah, and I think it's just a good reminder. You really have to know what's happening in breastfeeding. The vagina naturally loses its lubrication because of this menopause effect. So, you just give the warning sign of like, look, you're going to need a lube. It's going to be helpful, especially if you're breastfeeding. I actually also recommend vaginal dilators that are helpful at the entrance, because nothing's been in there. And again, the vagina shrinks a little bit at the opening, nothing's been in there. And then with the low estrogen, dryness. So dilators can be helpful as well, and taking it slow. And sometimes it's not about penetration. You certainly can enjoy intimacy and sexual pleasure through, oral sex or just touching. So keep that in mind also until you're, feeling more confident. But the 9-month rule, I always want to reiterate, took you 9 months to get there at least, and give yourself 9 months on the back end to let your body heal.
That goes for everything, including losing any weight you gained. You've got to cut yourself some slack, and cut yourself a slice of cheese too, because you need to remember to eat postpartum and to feed yourself well so you can recover. And recovery is not a 6-week magical wave the magic wand. As you said, there's the important 4th trimester and beyond. I mean, when you're talking about things like perinatal mood and anxiety disorders, those can start anytime during the first year. So listen to your body. And if you are concerned about any symptom, don't hesitate to ask. And also don't hesitate, I would say, to assume it's, business as usual, postpartum business as usual, pregnancy business as usual. And if someone doesn't take your concern seriously, make sure you get your questions answered, right? Really important.
100%.
We have another great question. In terms of getting the labor party started, right? We have a lot, my favorite suggestion is have sex, because as long as it's been okay as long as your water hasn't broken, you can have sex up right until the time, you deliver. But one of the questions here is about nipple stimulation. If you are getting a lot of nipple stimulation just for fun, are there any reasons to be concerned about whether that nipple stimulation, which is also used, tedious process, not as much fun as it sounds like, to help induce labor? So what you're doing it just for fun, do you have to worry about labor starting?
This is a good question. And the truth is, if you stimulate your nipples, your natural oxytocin, right? Pitocin, you've heard about. That's what we give women to make them contract. If you stimulate your nipples, you will start to contract at term. I did this myself, and I thought I was so smart. Like, I knew this, and I did contract for like 6 hours, and then it stopped. But a lot of women, it won't really put you in labor if you're in early labor, prodromal labor. If you did a little nipple stimulation, it's probably fine. You just have to be careful. And, we always worry about it because it does produce your natural oxytocin, which can bring on contractions.
Very intensely, it can, just as oxytocin can. So use with care. Oh, we have so many questions. Are there any particular risks to having sex after a C-section?
Well, again, if you're sort of waiting for the sutures to heal, it's like the 4-week rule. The reason we wait 6 weeks is that's sort of when things get back to normal. Your uterus is its normal size again. The cervix is now closed completely if you've had a vaginal birth or even a C-section, depending on that circumstances. But there is a sort of recovery time. The 6-week rule, if you wait till after, again, a lot of the studies show that the women who've had a vaginal birth and a C-section at that 6-week mark really had the same sort of issues, especially as it relates to vaginal dryness and, that whole process. There's been, pelvic floor damage, just being pregnant, not even if you haven't had a vaginal birth. So the answer to that question is, you can go ahead at 6 weeks and resume intercourse if you've had a C-section too.
Can I just put one reminder in there? Whenever you have sex for the first time, if it is not protected sex, can we just blow that myth out of the water that breastfeeding is contraception, that you can't get pregnant if you're breastfeeding? And by the way, I want to point out that you can get pregnant before you get a period, because you can ovulate first before you get a period. So you never even know that where in the cycle you are. You might get your period first, you might ovulate first. If you don't want to be pregnant immediately after delivering your baby, get that contraception, put it, at the ready before you even think about having sex. Right?
Well said, Heidi. I agree 100%. And you will ovulate before you get a period. And that's how people get pregnant unexpectedly. So use a condom. And that the other thing, at that 6-week visit, your healthcare provider will go over, birth control options. Right. So I think that was a good point to bring up.
Great. Because, planned pregnancy, really good for the body, I would say, and the soul and everything. So I can't thank you enough, Dr. Sherry, for joining us today. We got through so much information that we almost ran out of questions, and the questions were amazing. So thank you, moms watching and dads watching at home. And I think it's really important to point out where we can reach you. So you're at drsherry.com, Instagram, you are Dr. Sherry R, and also Sheology. We'll have those in the link, and Facebook. You got a lot of Twitter. You even tweet.
All over. Love to educate. And so thank you so much for having me. It's a lot of fun.
As do I. So we'll be educating more in the future, but thanks again.